Hello everyone, I'm Dr. Soumyadeep Ghosh, a fellow at abdominal radiology from Massachusetts General Hospital, and for the next 3 minutes, we will talk everything endometrioma, from presentations, relevant complications, and impact on patient management. We have no disclosures. These are our teaching points. Here we have a patient with a right ovarian cyst with low-level internal echoes on ultrasound, giving the classic ground glass appearance. MRI shows T2 shading, T2 dark spot, and light bulb T1 brightness. Image from laparoscopic resection shows the right-sided endometrioma. High-power photomicrograph shows endometrial stroma with scattered hemorrhages and hemosiderin-laden macrophages. Peritoneal endometriosis is characterized by the growth of functional, ectopic endometrial glands and stroma along the peritoneum. Here we have a patient with endometriotic cysts abutting the serosal surface of the sigmoid colon. Hepatic endometriosis is a rare form of extrapelvic endometriosis, commonly diagnosed at pathology following excision. Here we have a patient with a perihepatic collection with internal debris on ultrasound. MRI shows the classic imaging signs of an endometriotic cyst. Endometriomas can very rarely harbor malignancy. Here we have a patient with a mural nodule seen with a right ovarian cyst on ultrasound. Pelvic MRI shows bilateral ovarian endometriomas with enhancing mural nodules. Surgical pathology showed clear cell carcinoma. Here we have bilateral ovarian endometriomas with smooth T2 hyperintense soft tissue masses that regressed after delivery of the fetus. Is this malignancy? This is an example of decidualization. In pregnant women with endometriosis, ectopic stromal endometrial cells are stimulated by hormones causing endometriotic foci to produce solid, highly vascular nodules within endometriomas, aka decidualization. Here we have a patient with a right adnexal cyst with ascites and extensive peritoneal and omental nodularity. Is this disseminated malignancy? Note the gradual reduction in the size of the endometrioma on serial imaging. This is a case of ruptured endometrioma mimicking peritoneal carcinomatosis. Rupture of an endometriotic cyst is rare, with cysts larger than 6 centimeters more prone to rupture. Imaging clues include partial discontinuity of the rim of the adnexal cystic mass and hyperdense ascites. Let's look at a few mimics. Hemorrhagic ovarian cysts are typically thin-walled, unilocular adnexal cysts with fishnet appearance on ultrasound and inhomogeneous T1 hyperintensity. Complete resolution on follow-up ultrasound confirms the diagnosis. Ovarian dermoids show presence of intralesional fat. Mucinous ovarian cystadenomas are typically multilocular, thin-walled, with variable T1 and T2 signal intensity of its contents. Tubo-ovarian abscesses have irregular walls showing peripheral enhancement with heterogeneously T2 hyperintense, variably T1 hyperintense, and diffusion restricting contents. These are our take-home points. Thank you for your kind attention.